So, there's a story about a child whose arm got amputated because this child had been injected with the wrong drug in a certain hospital. It got me scared, and I got to think, wow, mistakes are made that can affect people's lives totally. This innocent child will live without an arm for the rest of their lives. So today, I feel I need to talk about what can be done to avoid mistakes with any kind of medicines. Hi, I'm Nurse Hanifa. So, in my practice, I see people working without preparing enough, especially before administering treatment. And by that, I'm basically talking about nurses. Yes, there are those who are very accurate and on point, and there are some who rush through administration of medication to patients and are very likely to make errors with these patients' lives. The reason I'm saying this, I've seen so many drugs that are packaged the same way. When it comes to injections, there are those that come in glass bottles, the small glass bottles that we call ampules, and they may come in the same dosages, like for example 2 mils, 1 mil, and they look so similar. So in this case, I believe nurses are supposed to read thoroughly as they are getting the medicine out of the storage space to the tray, medicine tray, and right before getting this med drug into the syringe to be administered to the patient, it should be read, the label should be read again to avoid mistakes. The other thing nurses should watch out for is the route of administration of injections. There are those drugs that are strictly supposed to be given in IV formulations. By IV, I mean intravenous, that is through the vein and not any other way. Sometimes these drugs are given the wrong way and therefore end up into trouble, or they cause problems for the patient. There are still drugs being given through the muscle, and in most cases, that is the gluteal muscle, that is the bums, and those drugs are supposed to be strictly given that area. That's if it is indicated on the drug that it's IM only. So, when we do read those labels repeatedly and we know how to calculate the doses correctly, give the right dose, there's no reason as to why we shall harm any patient. Other drugs people make mistakes with are the so-called drips, the bottles that they give through infusion. There are also those that want to look similar in size, but they're different. So reading their labels is very important. If someone misses that out, you can give a wrong drug to the wrong patient for the wrong condition, and therefore hindering or affecting their lives seriously. When it comes to the orals, that's tablets, capsules, any that is swallowed or taken through the mouth, they are also different. For them to be effective, there are those that have to be chewed, so we need to be very keen on the instructions, that is the prescription and the manufacturer's instructions. Those that are to be chewed are really absorbed through the mouth, within the mouth, and there are those that actually put under the tongue, and that is the quickest means of absorption of those drugs. So if they are to be put under the tongue, please let's give those instructions to the patient so that they benefit from the drug. Then those that are supposed to be swallowed with water, let's tell the patient to take with water. And whether it's before or after meals, let's be specific, because it really implicates a lot on the side effects and usefulness of the drug. For example, if you give a drug that is supposed to be taken with food, and the side effects would be, if not taken with food, it would make the patient sick and nauseated, or maybe have abdominal pain, you would have been the cause of the problem. And if we learn that we cause 80% of these problems to people who are seeking for help, I guess we'll do better. So this is a call to all health workers, especially nurses, dispensers and pharmacies, to please relay this information to patients as you're giving them the medicine, but also to the general population. We need to learn a few of the things. When you buy some medicine, please go ahead and ask the questions, relevant questions. How is, like for example, ask, how is this medicine going to help me? How long am I supposed to take it for? Should I take it with food or without? Should I take it at night or during day? And if they give you a specific time, ask why it should be taken at that specific time, so that next time you need to take that drug, you sure know the reason. It will help you not to actually become negligent on your part and choose a favorite time as you wish, which may later lead you into an unwell feeling, because some of these medicines, for example, the ones instructed for people to take at night, cause drowsiness, and therefore normally they instruct people to take them at night, hoping that they will be going to sleep. So it's necessary for you to know when and why you should take that medicine at a specific time. I guess if we all learn that, we'll be better, and these medicines will be really, really useful. Hope I've spoken about something important, and I hope we all benefit.